I'd like to welcome you to this quick chat about the UK Stroke Forum, which I'm really looking forward to. I've got with me Dr. Lauren Hepworth, who's the lead of the Stroke at Neuro group of the British and Irish Orthoptic Society, and Dr. Steve Green, who's a clinical neuropsychologist and the lead of the British Psychological Society. We're all three members of the UK Stroke Forum Planning Group. I myself, I'm the incoming chair. I'm also a professor of stroke medicine and a clinic and a practicing stroke physician. And I'd like to ask Lauren first, what particularly interests you of the forthcoming conference?
Thanks, Christine. So I think the first session I'm really looking forward to is the opening plenary. It usually gets UKSF off to and sets the scene. It sort of gets us off with a bang. Following that, there are 3 parallel sessions that I want to attend, so I need to split myself in 3. But this year I don't have a choice. I will be speaking in one of those sessions alongside 2 stroke survivors and an eye-clinic liaison officer speaking about the impact of post-stroke visual impairment. But the rest of the programme looks jam-packed.
Yeah, so the session that I'm most looking forward to, and the one that's closest to my heart, is the Neuropsychology Support in Stroke Services parallel session on day 1. It's important to me, obviously, because it's the profession I work in, but also because it is highlighted in guidelines and recently in the PREMS report, the need for psychological support. So in order to explore a little bit about what we do and explain a little bit about what neuropsychology is, we've got some fantastic speakers. We've got Kat Ford and Irene Conti talking about the latest research for neuropsychology in stroke services. We're very fortunate to have Brian Thorogood to speak of his experiences of stroke services. We've got Gila Balesi, who's going to talk about the delivery of neuropsychology across the whole stroke pathway, from acute supporting the MDT into rehab and community and life after stroke. And then we've got Mark Griffiths, who's going to talk about what the implications of guidelines are for stroke services, for commissioners, for service managers. So that's something that I'm really looking forward to, and I think is really timely and really important session for us to be promoting at the moment.
And I was particularly interested in those sessions which take together all the different attendants, so the doctors, the nurses, the therapists, and bring together life after stroke. And I think one of them, which I'm really looking forward to, is singing after stroke on the soapbox on Monday, to see how that can improve quality of experience for patients. And of course, something we never talk about, which again joins all our specialties, and that's sex after stroke. And I'm really excited to find that we've got a patient and therapists talking in that session on the Monday afternoon. So I think there's a lot for us to learn. Lauren, how do you feel about those sessions? Are you going to attend them?
I think the sex after stroke actually clashes with another session that I plan to attend, which is around research and increasing the speed, but spending with less waste, which I think is crucial, isn't it, with how the NHS is currently and how funding, especially in stroke, is so limited. It was really interesting to hear Stephen outline the neuropsychological session, because that's the one that clashes with the impact of post-stroke visual impairment, which unfortunately I will be unable to attend your session, Stephen, but I will be watching it on the app afterwards.
I think that's the really great thing, isn't it? There are so many things in parallel which I'd also like to watch and can't go to, but we can always see it in the app. And I think and the app is going to be available much earlier this time than it has been before, the talks. So that will make a big difference. So I may spend my evenings going through things I haven't seen. We've talked a lot about the sort of therapy aspects, the psychological aspects, but of course there's a lot for the medicine there as well. We've got the guidelines, and they go across obviously all parts of stroke care, but lots of new advice for implementation medically. There is a session on acute stroke management. There's a session for those who are interested in imaging to learn how to do the CTPA, and there's a debate on antiplatelets. And what I particularly always look forward for is the last session, which really brings together the take-home messages where we can make a change. So I think this is a packed conference with enough medicine to keep me absolutely excited and updated for the next year, and interesting other sessions from nursing and therapies to give me a wider range of knowledge. From those, I suppose from a therapy point of view, what I'd like to find out most is how we're going to manage to do the 3 hours therapy, which has which has been in the guidelines and been in the news lately, and quite a few of those sessions are addressing that.
Absolutely. I think there is another few sessions that span across medicine, nursing and therapy, as well as the couple of sessions on patient-reported experience survey that's recently been in the news, and the session on putting the person back into stroke measurement, which is focusing on patient-reported outcome measures. I think those sessions again span all disciplines. And I don't think I could leave this conversation without mentioning the Princess Margaret Memorial Lecture, which is particularly important for the British and Irish Orthoptic Society this year, with Professor Fiona Rowe presenting her vision on vision, which will hopefully showcase where stroke vision care has sort of come from and is still progressing even now.
Yeah, I think for a session to be attended by both doctors and nurses is also the oral healthcare session. In the past, we've always, as a doctor, I've always left an oral healthcare to the nurses, because brushing teeth is not a medical job. But I've seen increasingly that patients are getting pneumonia, and they're getting pneumonia because they've got really problems keeping their mouth healthy and clean, because they can't brush their teeth and they can't swallow, and it's a very specialist field, which, if we want to prevent pneumonia, we have to keep the mouth clean. And I'm really excited to find out what Craig Smith has to say in this session.
I'd also, if this is okay, just like to give a quick shout out to Stephanie Rossett and Kathleen Van Cleef for their session on assessment and rehab of visual perception, visual neglect problems after stroke. I've had the fortunate opportunity to work closely with them both on developing that, and we have Audrey Bowen and Christine Hazelton as well contributing to that session. That's something that I'm personally really looking forward to, some innovative approaches to assessment and rehab, which I think would be really interesting.
It sounds like it's going to be an absolutely fantastic meeting. I just can't wait. And thank you very much to you, Lauren and Steve. And I hope to see you in the conference as well.
Looking forward to it.
Seeing you there, Christine.
Bye.
Bye.
Goodbye.